is Bianca Nunez, and I'm a full-time nursing student at Nevada State College, and I'm here today with my professor, Marcellus. So today in our office, we have patient present Veronica Fernandez. Her date of birth is 11/26/1965. Today the patient came in to get an assessment done. The assessments we performed on the patient was for hair, skins, and nails, as well as the thorax and lungs. When we performed these assessments on the patient, everything came out pretty good. As far as her vital signs go, her temperature was 98.7, her pulse ox was 95%, her blood pressure was 120/84, as well as her pain was about a 4, and also her respirations were 16. The patient did appear to be alert and orientated. So for the background part of her, Miss Fernandez, she doesn't have any family history of like any skin cancer nor any lung cancer, so no family history whatsoever. She doesn't have any history of any well, she does have some history about some lung problems. She had a chronic cough in the past that lasted about 6 months. I asked her if the cough produced any mucus, and she informed me it didn't. It was more so of a dry cough, and they believed it was possibly asthma, but they still didn't diagnose it. Also, she has some issues with her skin. She's been having some dry skin lately, which has been something that's new, due to the fact of her Solaris treatment, which is a treatment she takes for her NMO and transverse myelitis. Also, the patient doesn't have any history such as smoking whatsoever, or even using illicit drugs. Also, for the hair and nails assessment, everything came out pretty good. For skin, she didn't have any discoloration. She did have some moles throughout her skin and some striae, such as in like the axillary area. She did have some cherry aganomas in her back. Also, the patient's hair, it did appear to be a little thin, but there was no appearance of any possible lesions or whatsoever. The patient's scalp had no redness, so no history like of any hair problems. She also didn't have any she didn't have an oily scalp as well. As for nails, they were good, no signs of cyanosis. The cap refill was less than 3 seconds, which is great. As for her thorax and lungs, there was some abnormalities. As for her posterior side of the thorax, her bronchi, breaths were clear. Her bronchi vascular breaths were clear, but her vascular breaths had some crackles, so she did have some adventitious sounds. As for her anterior side, her bronchi were cleared. Her bronchi vascular breaths were cleared as well. And for her vascular's anterior side breaths, they were also had, I did notice some crackle sounds as well. So there was some adventitious sounds there. There was no abnormalities. Everything appeared to be symmetrical. The patient did claim she had some pain, but that's because of, like I said before, because of her disorder. And something I would recommend the patient is to definitely follow up with a respiratory doctor to see why she had a chronic cough for so long, to see if maybe we can rule out possible asthma. Thank you. Have a nice day.